Hello again, everyone, and welcome back to Reddit Aliens. I'm John, and as always, thank you so much for being here. A tough topic today. Let's do it. People who work in hospitals. What's the worst way you saw a patient suffer or what they went through? Please remember to like, share, and subscribe. I was in my second clinical rotation as a nursing student. We were assigned patients, and the patient I was assigned to was a grumpy old guy who was 79. He had a good sense of humor, but you had to tread carefully around him. He had chronic pain and was diagnosed with colon cancer. His son would visit in the mornings, just in time to talk to the doctors doing their morning rounds. His wife had passed a few years earlier. I was helping him get ready for breakfast when the doctor walked in. This was pretty typical, but he was anxious to see the doctor today, as he just had a bunch of tests done and was hoping to hear some results so he could be discharged to go home. I usually just finished up whatever I'm doing and leave so that the patient and doctor can talk privately. That morning, his son was not able to make it in, and my patient asked if I could stay in the room with him to hear everything, in case he missed something. I said, sure, no problem, as long as the doctor is okay with it as well. Some doctors don't like dealing with students. The doctor just got right to the point. The cancer had spread, and there was nothing more they could do. The palliative team would be coming to meet with him this afternoon to discuss where he could be transferred during his final days. My patient thought the doctor was joking and started to laugh, then just sat there with a completely blank look. As a student, I was not prepared to know how to comfort someone in that situation, as it was something I didn't have experience with. I felt awful, because 10 minutes before he got this news, he was telling me he couldn't wait to see his cat once he got home. For the next week, he did not get out of bed, refused to eat, take medication, or shower. And then I came in one day and he was transferred out. This isn't from me, but from my mother. She's an ER surgeon. This little girl, probably 6 or 7, had some form of spinal cancer. My mother had met and talked to her a couple of times. On this particular day, she was excited because her dad was coming home from a business trip to Bali. This little girl was so happy because he was bringing her back a toy. The next day, the Bali bombings, which killed her father. She was distraught and spent the next 4 days just crying, with little bits of sleep in between. Her mother spent most of that time with her daughter. About 2 months later, the mother passed away in a car accident while driving to the hospital to visit her daughter. So her grandparents got the duty of caring for her, but she passed away 2 weeks later from cancer. The poor girl suffered worse than I could have imagined in her last 2.5 months of life, losing most of what was important to her before dying herself. I hope no one goes through anything like that again. My mother thinks she just gave up after her mother passed. This little girl lost everything just by some form of shit luck. My mother leaves flowers on her and her parents' graves every year on the anniversary of her death. Sometimes I really do not understand how my mother deals with being in the ER. She's quite possibly the strongest person I know, just because of that. I was a patient in a hospital for a heart issue when I was 22. They kept me for 3 days in the cardiac ward, and I shared a room with an older gentleman who I believed was around 80 to 5 based on his visitors. I never saw him behind the privacy curtain. I was completely okay and sitting up in bed, working on schoolwork most of my visit when his family came in. I could tell the situation was bad. His whole extended family came, everyone from his wife to his grandchildren. He was also on a ventilator that was keeping his breathing up. I'm not a medical person, but as I understand it, this tube is down in your throat. On the same night after they all visited, he tried to pull everything off, and it set off an alarm and a nurse rushed in. All I could hear from a very muffled voice as the nurse tried to tell him he needed this equipment to live was, "What kind of life is this?" It made me question my own issues and cry in the dark next to him. I got sent to the pediatric ICU to watch over a 16-year-old who tried to shoot himself in the head in a failed suicide attempt. He broke the bones that holds his eyes in and lost all function of his eyes for obvious reasons. And he also shattered the part of the skull holding the brain out of his upper sinus. He was very confused and obviously terrified. He had just learned he was going to be blind for the rest of his life and needed a new skull fragment put in to keep the brain in place. On top of all of this, his divorced parents were fighting, and the dad blamed the mom because he used her gun. The mom then refused to let the dad visit by not giving him the special code you need to get on the unit. It was the single most effed up night I've worked, and I refused to go to that unit ever again. A guy got in a car accident, broke his back, and was told that he'd never walk again. When they tried doing therapy, he started wiggling his toes, so some hope came back into the picture. The transport dropped him when transferring him from the bed to the stretcher and broke his back all over again. That was 20 years ago now, and he's never moved a toe again. Don't forget to lock the bed or brace the stretchers, kids. ICU. A lady who was roughly 40 years old and paralyzed from the chest down due to a car accident years prior is currently on a ventilator through her trach and has a permanent feeding tube inserted in her stomach. When I saw her, she had a bleed in her stomach that was seeping out through the tube, and she kept pulling out her trach in an effort to end it all. They ended up having to sedate her pretty heavily to keep her from repeatedly pulling the tube out. Seeing her pull the tube loose and watching her actively begin to suffocate with a totally blank look in her eyes was chilling. I cleaned the rooms of the ER in my local hospital as a summer job. This woman in her 40s was dying from cancer, and she had a room in the ER for a couple of days to wait for another room in another service. She looked fine for someone who was dying. I mean, she was bald and looked ill, but she was nice and lovely to be around, cheerful, etc. One time I was cleaning the corridor when I heard cries from her room. I opened the door and there she was on the floor. She fell from her bed after trying to walk to the bathroom. I helped her to the bathroom as she was crying in pain and in fear because she realized she could not walk anymore and that her end was coming. She broke my heart. It was the first time I realized where I was really working. I had a 94-year-old woman who had been beaten by her niece so horribly that she was intubated in the ICU. The woman was in pure agony, and her family wanted to do everything for her. Come to find out, they were keeping her alive and collecting her social security check. While cleaning her up, she grabs my arm and holds it tight. Huge tears well up in her eyes. She looks at me and mouths over the ET tube, "I want to die. Please let me die." That night I sobbed the entire way home. I was doing a clinical rotation in the ER when the ambulance called and said they were about 10 minutes out with a 19-year-old male with a close-range gunshot wound to his upper left chest area. Think the front of your shoulder, just below the collarbone. He came home early and some guys were robbing his house, so they shot him and took off. His parents had to wait in the lobby for the police to finish up with him before they could see him. The angry look on his father's face and the wailing sound that his mother was making are not things I will soon forget. The kid made a full recovery, by the way. He's got a small scar and a story to tell. I was choked up for a few of these today, especially stuff with kids, so you probably hear it. So it's nice to have this story in particular have a happy ending, and I'm happy for that person and his family. So I've seen many people die, but the worst one by far was a man with active bleeding, hemorrhaging from his esophagus due to long-term alcoholism. This was many years ago, and there are better ways to treat it now, but at the time, the treatment for this kind of hemorrhage was putting an inflatable tube down the throat into the stomach. It was attached to some kind of helmet that you had to put on the patient afterwards, which was tough. You would not only inflate the tube to stop the bleeding, but also aspirate the blood out of the stomach with a huge syringe. Just putting it in was horrible. The patient was so scared. There was blood everywhere. He was vomiting blood and shitting blood. He couldn't hardly talk due to the bleeding. This was in the ER. We've got IVs in him, and we started transfusions pouring into him as fast as they go. We worked on him for a long time, but he didn't make it. What I remember is how hard he fought, how scared he was, and how much blood there was. And this was before rubber gloves were worn for everything. I just threw out my uniform. Everyone's shoes were soaked. I never saw anything like it before or since. Don't become an alcoholic. Don't get cirrhosis or esophageal varices. It's a bad way to go. I volunteered at a children's hospital throughout high school. There was a 16-year-old patient there who had spina bifida and had no feeling beneath the waist. He had routine surgery and was expected to be in the hospital for about a week. The worst thing I've ever seen was the look on his face when he told me that the doctors had found MRSA on both of his legs and that he wouldn't be leaving the hospital anytime soon. Hospital trips are kind of funny. The first week everybody wants to visit you, but after that, guests seem to taper off dramatically. I remember him stating the hardest thing for him was the lack of social support beyond his family, and to a much lesser extent myself, as this was like the year before Facebook really became a thing that everybody had. Happy ending though. He eventually did recover from MRSA after spending about 6 months in the hospital. I worked at the hospital in high school. I delivered food trays to hospital rooms, so it was a very easy job. We were encouraged to have brief conversations with the patients to try and cheer them up a bit. The hardest one to deal with was our high school principal. Our principal dealt with 2,700 students, but was beloved by all. Not often do you find a person like that. Well, one day she got really sick and had to go to the hospital. I walked into her room and saw her in there. Somehow she remembered my name after I'd only met her maybe twice. I saw her every day I worked, and I saw her degrading for months. All during this time, people in school had rumors that she was getting better. Somebody's mom saw her shopping. People heard she was coming back next week, etc. I couldn't say anything, obviously, but it was very hard to deal with watching so many people have hope and knowing that this truly wasn't looking good. She died about 3 months into being in the hospital. The school was devastated. Basically, anytime a patient, especially the elderly, is hanging on with every possible form of life support, vent, dialysis, repetitive coding, the family refuses to make them a DNR. I know it's a hard decision to make. I know you don't want to see them die. You also don't want to be in the room when they code. You don't want to be in the room the third time they code, wondering if we'll be able to bring your loved one back again, just to see his chest rise and fall mechanically, to see him being turned every hour and leaving the room so that your modest dad can have some privacy while we clean him up because he can't control his bowels. Please think about what the person would have wanted. 2 of them are senior citizens. They both haunt me years later because I don't know what happened to either of them. The first came in as a homeless woman in the winter. She was fine medically, but she was homeless because her husband had died, and her absolute demons of children took the family home from under her, leaving her on the street. Somehow ended up in my city. They put her on a psych hold just so she had somewhere to sleep while they figured out where she could go. She was in her 80s. Her entire life was in a grocery bag. The other was a transfer to our ER after being medically cleared elsewhere, because ours has a psych ER and the other main hospital in the area does not. She was also in her 80s, I believe. She was the sole caretaker of her very ill husband and reached a point where she felt it was impossible. Just everything, life. She was so tired. So she drugged her husband and herself so that they could die together. He died. She lived and was sent for a psych eval. I assume there was a criminal or legal discussion as well. I wish I had remembered her name just so I could try and find the outcome. Work in a mental health hospital, effing dementia, horrible. Horrible disease that affects the people you love more than you because on the good days, you don't know you have it. I've seen people screaming out for their wives or husbands who died years ago. What do you tell them? They're dead? Why put them through that again? Do you lie and say they're on their way, doing or shopping, or something else? Knowing that will placate them for 10 to 15 minutes until they ask again? Dementia. I don't think there's an illness worse. I wasn't employed by the hospital, but worked as an interfacility transport EMT at the time. I had one patient who had terminal bone cancer and was morbidly obese. I was transporting her from the hospital to a radiation appointment. I delivered and developed a rapport with her, and she opened up and told me how she is just buying maybe 6 months by treating the cancer. Otherwise, she would have died already. Well, as some of you may know, bone cancer is one of the most painful and terrible ways to die. So for her to extend that misery for just a little longer so she could experience life and see her family a little longer was very inspirational. We get to the facility to do the radiation treatment and are told it should only take about 45 minutes. Then we get to the room where the magic happens, and the tables she's supposed to lay on is the same size a small adult would use. They have no modified version for morbidly obese adults. The only way to keep her on is with the extra straps they use to tie her down on the table. They constantly have to stop the procedure to adjust her for comfort. The 2 hours of fentanyl she was given at the hospital have completely worn off, and the facility isn't authorized to administer medications like that. The appointment ended up taking about 4 hours longer than it should have, and she was just miserable, but still so sweet and apologetic the whole time. I felt awful for her, and after it was done, there was a huge sense of relief in her voice. I told her how inspirational she was to me and how resilient she was being. Okay, so technically I worked at a nursing home, and I myself wasn't a nurse, but one of the kitchen workers who fed the residents. How it works is that I bring up carts of hot food, serve the meals on plates according to resident cards, which specify their diets and what they could and couldn't eat. Resident has no teeth, no hard foods. Resident can't eat salt, etc. And then the nurses bring them to the designated resident. Sometimes they could eat on their own, and sometimes they needed a nurse to feed them. Typically, these meals come with a dessert. Depending on their needs and diet, it could be a piece of fruit or something like a cake or pudding. So during one of my shifts, I had just served dinner to the 3rd floor and was packing up to go back to the kitchen. As I was packing up, there was an old lady who I knew as someone who needed to be fed because she had lost a lot of coordination with her arms and was wheelchair bound. Her nurse, who was supposed to be feeding her, was way too busy yammering away at another nurse. So this resident, who was obviously hungry, tried to feed herself the blueberry pie and naturally made a mess of herself. Poor lady has blueberries all over her face and shirt, and the nurse, who should have been feeding her, gets upset and decides the resident doesn't get to eat dinner since she can't behave, and wheels her into a corner like she was in timeout, all while she's covered in food. The resident is obviously so embarrassed and just wants help being cleaned, but the nurse walks away before she can even finish her sentence. It isn't unusual for residents to not eat food because it was pretty gross, or maybe they weren't feeling it. It happens. So I went downstairs back to the kitchen, cleaned, and did my tasks. I usually come back up to the floors every 2 to 3 hours to collect dishes and drop off overnight snacks. I come back up to the 3rd floor, and to my effing horror, that resident is still in the same corner, covered in blueberry sauce. I walked over to the nurse's station and told him about a resident needing help, and thankfully another nurse came in and took her back to her room and cleaned her up because her shitty designated nurse was nowhere to be found. I cried that entire night after my shift. This poor woman is in a facility because she needs constant help and care, and she was treated like an effing nuisance by this asshole nurse. That hospital and that nurse. That place was literally hell on earth. In clinical on a burn trauma unit, the guy had 3rd-degree burns on 80% of his body. He had very little clean skin left. I could actually see part of his tibia, and his fingertips were necrotic. He was heavily medicated, but still, I can't even fathom the pain. I don't know if he made it because he was quite skeptical the last time I was there. I now work in the NICU. Most of the babies end up doing pretty well and going home eventually, but some aren't so lucky. I can go on about the medical stuff, but really, the worst is when their parents don't give a shit about them. Some parents live far away and have other kids to care for, so it's understandable if they aren't there every day. But then there are others who never call or visit, and no one can track them down. So the kid ends up being discharged to foster care. It just burns deep in my soul sometimes. One day I might hand a perfectly nice couple their baby to hold one last time while we withdraw life support, and the next day I'll be trying to soothe the baby, withdrawing from the drugs his MIA mom took. Despite the challenges, I still love my job though. I'm a children's nurse. I worked in a ward that specializes in brain and spinal tumors in children amongst other specialties. The worst thing I can think of was a little boy. I think he was 3 or 4 years old. He'd been in a different hospital for 2 weeks with a weakness in his legs that was seeping up his body, eventually causing incontinence. The other hospital hadn't scanned him, which was the first thing we did, and we found his brain and spine were covered in tumors. There was literally nothing we could do. He had weeks, if not days left. On my shift, he was incredibly poorly, and I was trying to push for him to get moved to the ICU. He was barely conscious, and there were a few times while I was waiting for the medical team that I actually thought he died in front of me. Being with his poor parents as they went through this and watching their typical, previously healthy child fade away with no information was the worst. The mom asks, "Will he live? Please save my baby." It was truly awful. I'd been a nurse for a few years and thought I was pretty awesome. A patient in the ICU was unstable with a heart problem, but with meds, she was pretty stable when my shift started. She was a DNR with heart failure. The family had been there for days. Husband, adult sons, and daughter-in-law. They were the nicest folk. They were contemplating going home for a few hours to shower, eat, and rest. I told them her heart rhythm looked good. Go home and get some rest. I took their cell phone numbers and told them if anything changed, I would call right away. Well, they traveled for at least an hour through a dead zone because as soon as they walked out of the door, I was struggling to keep her alive. Her heart was all over the place. Pressure kept dropping and dropping. I got them on the phone an hour later and told them to come back. I spent 2 hours desperately trying to keep her alive, and they ran back in the door 5 minutes after she was gone. I couldn't stop crying. I felt so bad. There was no professional boundary there at all. We all knew a young, stupid nurse took their last moments with their mother, and mom died alone, with a few scattered staff doing what they could, but without her family by her side. That family comforted me more than I comforted them. I was beside myself. They told me I did my best and it was okay. The grace and kindness they showed me were incredible and affect the way I treat people and every family now. In residency, I took care of a young boy, 8 years old, with E. coli 0157H7. No one knows where he got it, and it wasn't part of a bigger outbreak. I'll never forget the screams of pain from the severe abdominal pain and bloody diarrhea, but then I'd go in the room to check on him, and when I asked him how he was, he'd say in his weak little voice, "I'm okay," even when doubled over. Such a tough kid. There's no treatment besides supportive treatments, fluids, and pain relief, because antibiotics make renal failure more likely. Unfortunately, he did go into renal failure anyway, and he died before dialysis could be started. In medical school, I took care of a middle-aged woman with advanced uterine cancer. She was extremely obese, over 400 pounds, so it was too difficult to do her hysterectomy without first doing a panniculectomy, basically removing her pannus, which is excess abdominal fat. This involved an incision in a circle around her entire abdomen, which was extremely painful as it healed, since her whole abdomen was involved, so she was essentially bedridden post-op. Because she didn't move, she developed terrible pressure ulcers in her back, a couple of which ulcerated all the way to her bones. She had a ton of fat on her back too, so these ulcers were deep. I could get my whole arm up to the elbow inside of them when changing her dressings. She'd scream and sob anytime we moved her. I don't remember anyone ever coming to visit her, and I'm pretty sure she eventually died alone.